everybody. Welcome, everyone. And thank you for those joining us live. And to those listening in afterwards, I would like to warmly welcome our guests of today, whom I will shortly introduce. My name is Prosper Yag. I'm the president of the African Pharmaceutical Forum. I will be moderating with Jacqueline Suré, who is hospital practitioner, hospital pharmacist in France, and former vice president, and our past liaison official for Africa region. Some announcements. This webinar is being recorded and live streamed via YouTube. The recording will be available on our website. You may ask questions using the question box provided. You are welcome to provide feedback to webinar@fip.org. To become a member, you can become a member of FIP. Then you will go to the FIP membership registration. There will be certificate of attendee for those who will join us for this event. The FIP Transforming Vaccinations Globally and Regionally program delivered in 2020 was the first FIP digital digital program, which culminated in a global summit and FIP commitment to action on improving vaccination coverage through pharmacies, as well as a digital collection on transformation vaccinations. Next. In 2021, FIP is renewing its partnership with Pfizer and is launching its second program that focuses more on equity and sustainability of vaccination, building on outcomes of 2020 program. The FIP 21 digital program focuses on supporting FIP members in accelerating programs of equity, access, and sustainability of vaccination through policy development and implementation through 2 series, with a total of 12 events. Next slide. The first of the 2 series comprise 5 episodes, which include an opening event alongside 4 other events which explore equity in vaccination across the different angles of age, gender, literacy and education, and collaboration and working together. Next slide. The second of the 2 series in 2021 comprised 7 digital events, including 6 regional roundtables, which will discuss and identify priorities for sustainable access to vaccination through pharmacies around the world. The program will end with a leadership summit in which we present a commitment to action on sustainable and equitable access to vaccine through pharmacies. Next. Transforming Vaccination 2001 key outcomes. "12 digital events, including 6 regional roundtables and a leadership summit. Second, FIP global commitment to accelerate equity, access and sustainability on vaccination Third, special policy collection. I'm now handing over to my colleague, co-moderator, Jacqueline Surek. You have the floor, Jacqueline.
Thank you, Prosper, for this nice introduction of this program, which is so promising and so important for your region. So let us see now in the two next slides the outcome, in a nutshell, all the outcomes of this program. First of all, we have advocacy. And advocacy is so important because advocacy includes a political aspect. And you must be aware, and everybody is aware, that without any political aspect in all what we do, there is no outcome. So politics is so important. And this is what comes out from this slide. Advocate regulatory stakeholders and politicians on the asset which pharmacists represent to increase the vaccination coverage and on the absence of regulation for pharmacists to do so. And this is almost valuable for every country in the world. Advocate the other healthcare professionals to raise awareness and establish a trustful collaboration, and advocate the pharmacists themselves to encourage them and provide support through professional associations and learned societies and others, and we will see that later on. The next slide details another feature after advocacy. It's education. Of course, education is key. We must organize practical hands-on workshops on vaccination. They might be organized by learned societies, of course, but they also have to be organized by the pharmacy school or University of Pharmacy. FIP and other international organizations has a great role in organizing this kind of education. Vaccination training should be integrated to pre-graduate pharmacy curriculum in the future. And I'm sure it will be the case one day or another. And the last feature, but not the least, is finances, because finances, without any finances, we won't be able to perform much. The vaccination training must be budgeted. The means which are needed have to be provided to ensure vaccination adequate storage. And this is so important in African countries because of the cold chain maintenance and respect. And the Vaccination Act must also be financially compensated. Otherwise, it won't be maintained easily. In the next slide, we will see the challenges, because there is, of course, challenges to be overcome. The challenges first with the other healthcare professionals, and we have that in every country. Vaccination may be seen as within the purview of other healthcare professionals, and then it will be perceived of an attempt by pharmacists. We must overcome that with good communication. We must be convincing, and we must overcome that. And there is also challenges with pharmacists. Some of the pharmacists would be, for instance, reluctant to go for vaccination. They would have some difficulties in acquiring new skills or in reviving old skills. There is also an added responsibility for immunization, and there might be also a backfiring from possible adverse drug reactions, though this must be overcome. A misunderstanding of legal provision is another aspect of the challenges with pharmacists. And with the next slide, we see some logistic challenge with the respect of cold chain, which is really a challenge in African countries, as we have already mentioned. And of course, the financial challenges. Vaccination trained is not budgeted for pharmacists by pharmacies, and the Vaccination Act is usually not compensated in African regions, so it must be compensated. Okay, then the next. lesson learned whilst transforming vaccination for pharmacists is that, of course, education is a key factor. And there are some legislative enablers that have to be put forward to cope with the barriers. And one of the barriers is getting politicians sensibilized and regulatory stakeholders. It's not so easy to go and try to sensibilize politicians and all the stakeholders. It's a difficult task, and you must be very assertive to get this sensibilization effective. Also, the partnership with key authorities is very important. And of course, what is very helpful for all countries in the world is the endorsement from supranational organizations like FIP, of course, but African Pharmaceutical Forum is one, which is absolutely key for the African region, as is WHO and WHO for support in the process. So we have today 4 distinguished panelists to discuss all that. I will hand over to Prosper to have the privilege to present them. Prosper, back to you.
Thank you, Jacqueline. It's my pleasure and my honor to introduce Daniela Munene and Samuel Adekola. We have also Redouane Swalni from Algeria and Mariette Eskin from South Africa. Daniela Munene is CEO of PSK, Pharmaceutical Society of Kenya. Pharmacists with extensive experience in quality assurance, organizational, regulatory compliance, and health sector advocacy. Daniela has created and managed quality management system in the pharmaceutical distribution supply chain throughout her career. With a passion for health promotion, education, and people empowerment, Daniela has mobilized the pharmacy profession in Kenya to successfully advocate for change in health policies to ensure enhanced reach of primary healthcare. In this regard, she has been part of developing various health policy documents and at a global as well as country level. The title of her presentation, Transforming Vaccination Globally, Regionally, Nationally, Accelerating Equity, Access and Sustainability through Policy Development and Implementation, reflection from Kenya. I will also introduce my brother, Samuel Adekola, who is from Nigeria, a passionate community pharmacist from Sopok Akoko in Ondo State, Nigeria. To improve his pharmacy business competence, he proceeded to University of Benin, Edo State, Nigeria, in the year 2019, where he bagged the Doctor of Pharmacy, PharmD degree, after his degree of MBA from the Federal University of Technology, Akure, in 2004, and B.Pharm as first degree from Obafemi Awolowo University in Ife, Osun State, Nigeria. Samuel has local and international recognition. He has earned many awards across community of university students, chambers of commerce, FIP conference, faculty of pharmacy, pharmaceutical companies, PSN, ACPN, the media, is alma mater, and other professional bodies over the years. As a community pharmacist, he is the founder and owner of His Grace KSP Pharma Group, a reputable community pharmacy with currently 6 branches located in Ondo and Lagos states. To improve his delivery of pharmaceutical care to patients, he has harnessed personal skill development in the area of immunization, emergency management, and opioid overdosage response and naloxone training. I will give the floor to Jacqueline to present the 2 other panelists.
Prosper, maybe I present the 2 other panelists after the presentations of the 2 first ones.
Okay, then I will
give
the floor.
Okay, thank you.
Yes. I will give the floor to Daniela for his presentation. Sorry. Daniela, you have the floor.
Thank you, Prosper, for that introduction. I'm glad to be here. Today we're talking about sustainable and equitable access to vaccines, setting priorities and establishing priorities and setting policies in the African region. So first, I'd like to give you an overview of Kenya and where we're at. So in terms of vaccination, we're still in phase 1, where we have a target of vaccinating all adults in Kenya. First, we prioritized health workers, security officers, teachers, those above 58 years, and inmates. And then when we were done with those, then we moved on to the other people who are above 18 years. As you can see, we're really far from target. In total, we have vaccinated 78% of health workers, 14.5% of the elderly, and in total, generally, we're at 6.1%. Just for context, our population is 47.6 million and a very youthful one, because 94% of our population is below the age of 60. So far, we have carried out about 2.7 million tests with a positivity rate average of 9.4%. We have had about 250,000 cases to date and 5,000 deaths with a case fatality rate of 2.1%. So far, we have administered 5.4 million vaccines, but we have unequal vaccine distribution in our country. The highest is in the capital, Nairobi, and the lowest is in the marginalized counties, Marsabit, 0.8%. I'll give you a timeline of how things have moved from the case in the next slide and where we are with vaccination. So our prime case was identified on the 12th of March last year. She was a female traveling from the US via London. And in 3 months, the cases had grown exponentially. By June, local transmission was evident. It was no longer an imported epidemic. It was a local epidemic. Vaccines arrived in our country for the first time on the 3rd of March this year. And we launched a vaccination campaign that month. By 2nd November, which was 2 days ago, we've had 250,000 cases of COVID, but thankfully our positivity rate has gone below 1%. And most of our very restrictive measures have been eased, like lockdowns or curfews. And so far, we've had 6.1% of our adults vaccinated with at least 1 dose. Next slide, please. Now, what are our strengths and priorities as a country for ensuring equity, access, and sustainability of COVID vaccination? First, I'll talk about human resource for health and health facility readiness. We have engaged in this in earnest since the pandemic, even before the pandemic hit our country. And that was in terms of training and accreditation. And we continue to accredit more and more facilities to provide COVID vaccination. Number two, and very important, and it's still ongoing, is public sensitization. As a health sector, we are trying to create an accurate narrative of safety and efficacy of the vaccine to counter the false narratives and to give reliable information. We also give information on eligibility, when and where you can access the vaccine, and how to report adverse events. For this, we realized also that people from the health sector are not best placed to give these messages to the public. So as Kenya, we have heavily relied on social influencers, celebrities, artists, and the like, because their messages resonate with Kenyans. And I'm happy to say that vaccine hesitancy has dramatically dropped. The other priority that we have is resource mobilization that requires lobbying and advocacy for budgetary allocation, because this pandemic was not budgeted for. Donor support is not enough, but still we advocate both to our own government to allocate more resources for the things required, but also to our legacy donors in the health sector. One thing that really stands out in Kenya is private sector involvement. To provide context to you, private sector is not allowed to import their own vaccines. And so all vaccines are procured by government and distributed by government. And so since vaccines arrived in March this year, private in vaccinating their staff and communities at no cost, at no service fee. And we are administering vaccines to complement government program. And I'll even show you later on how we are even helping government to procure more vaccines. And the last priority, it's certainly not these are not the only 5 priorities, but these are the top that I picked. The final one is local manufacturing. We don't have local manufacturing of vaccines, of any vaccine, any human vaccine in our country. But we now have plans underway for a fill and foam plant that will begin packaging vaccine in April 2022. We will import ready-made vaccine in bulk and then package it here. And this will be a first step to moving towards a full production of vaccines. Now, in the next slide, I'll show you a case study or a success story of what the private sector has achieved in helping government in the vaccine initiative. So under the umbrella of the Kenya Private Sector Alliance, of which even Pharmaceutical Society of Kenya is a member, the private sector fundraised from its members to complement government procurement. Each company pledged to vaccinate its staff and surrounding community with the quota of vaccines that their contribution was worth. And so far, 70,000 Kenyans have been vaccinated under this program. So this is 70,000 more than would have been vaccinated had we relied purely on the monies from government to buy vaccines. Fundraising continues and will expand as vaccines become more available globally. And as private sector, we continue to administer all vaccines, both the ones that were bought for us by government with our own money, and also the ones that government has procured. We are providing those vaccines free of cost, no service fee, to patients that come to our health facilities. But we also have some learnings and some challenges that I'll show you in the next slide, and areas for improvement. One, as I mentioned, is we have no local money. This has made us very vulnerable to global supply chain constraints. So even when the government has the money to procure, the orders are heavily delayed. As you know, there hasn't been equity in access to vaccines. So we're not able to secure our orders when we pay for them or when we place the orders. And so we have to depend on the global supply chain to assure us of getting vaccines. Number two, false vaccine narratives still persist, leading to vaccine hesitancy in some quarters, and we are heavily combating this and using non-traditional means. We use, as I said, celebrities, even church leaders to combat these narratives. We also have unequal demand for vaccines. Some counties are demanding for it more. The urban areas are showing up in larger numbers to get their vaccines. And this has led to inequitable vaccine coverage because it's a voluntary, it's voluntary to go and get your vaccine. It's not a must. So we must look for ways of convincing those who are not convinced to still go and get their vaccine. The last weakness and challenge that I'll mention is very important, is underutilization of healthcare facilities. So private sector is heavily involved in rolling out vaccines, but not the community pharmacies. Why? Because we're not yet allowed to be COVID-19 vaccination centers. And this has, when we sort out the supply chain constraints and we can access as much vaccine as we want as a country, then the rate limiting step, the barrier there will be that we're not having enough outlets where the public can get vaccines. And we're really advocating to government to allow community pharmacies. Next slide. I'd like to focus more on the pharmacies, because this is one local policy change that as PSK, we feel is needed to be done to increase access and equity and sustainability in the vaccination drive. In Kenya, pharmacies are many. We have 5,500 countrywide. They're accessible, they're on every street corner. They're a trusted source of information, and they're trained. Not all are trained in immunization and administration of injectable medicines and vaccines, but the training has been ongoing. And we have people who are trained, and yet, you know, they are even administering other vaccines in their community pharmacies, which is great, and we celebrate that milestone, but they're not yet allowed to provide COVID vaccines in their outlets. Allowing community pharmacies to be vaccination centers will decrease congestion in hospitals and health centers, and bring services closer to the people, and also increase vaccination reach. I'm told to check my mic. Mila, could you confirm if you can hear me? I hope I can be heard. For many Kenyans, the community pharmacy is a trusted source of healthcare, health information, and health products. Now, we also have a global policy change that we require, that I'll show you in the next slide, that will ease and improve equity. So we're saying as PSK that for every vaccine made for developed countries, can one be made available for low and middle income countries? So if you look at the top there, you'll see vaccine coverage globally. In the United Arab Emirates, they have vaccine coverage of 97%.
Daniela, can I interrupt? Yeah. The thing is, there is a background in your mic. Have you got a door open or a window open where you are?
Yes, I apologize for that. I'm not able to stop the traffic where I am.
Okay, if you could close the door or something, because this is what the chat box says.
Okay.
Okay, thank you.
Thank you. I'm almost done. So in the United Arab Emirates, we have 97% of their people vaccinated. The global average is 50%. In Kenya, we're at 6.7%. And in Tanzania, we're at 1.7%. So there's a lot of inequity. And this has to be fixed. And like I said, we're always waiting for our vaccine orders. We place them, but other countries are able to access way faster than us, who are using subsidized facilities like the COVAX facility, the Africa Union facility. So can we say, for moral reason, for every vaccine made for developed countries, make one available for low and middle income countries? And We have to remember that no one is safe until all are safe, and we will not beat COVID until we all reach the threshold for herd immunity. My apologies for the interruptions with sound, but I hope you've followed from my slides, and that's my last slide. Back to you, moderator.
Thank you, Daniela. Sorry for the noise in your back. Thank you for this interesting presentation. 6.7 of the population vaccinated in your country, and the important role of the private sector to support the government's efforts to make many people access to vaccination. And pharmacy not yet allowed it to vaccinate COVID-19. This, I think we'll see this at the end of our session. Thank you. Samuel.
Yeah, Prisma, how are you?
I'm good. And you?
Yeah, I'm good.
Okay. How about Nigeria?
Yeah, right now we have pharmacists are yet given the opportunity to vaccinate. In terms of vaccination coverage, we're still less than 10% of Nigeria that we vaccinated, particularly for the COVID vaccine.
Okay, you can proceed with your presentation.
Okay, thank you very much. I will be talking on transforming vaccination globally, regionally, nationally, accelerating equity, assets, sustainability through policy development and implementation. As we all know, as pharmacists, we know that vaccination is an effective way to provide immunity against infectious disease with huge socioeconomic benefits. And regular routine immunization program ensure vaccine effectiveness and guarantee individual and community protection. Nonetheless, in many countries in Africa, vaccination coverage is known to be very low. And for example, in Africa, we have 20% of African children do not receive all the necessary and basic vaccination. This can be seen on the link. Again, as we speak today, taking the COVID vaccine as an example, less than 10% of African population has been confirmed to receive the COVID vaccine. And this is very poor compared to global average. Global immunization efforts are heavily focused on infants and children. Of course, this is not unusual. Africa is not let out of this. Next slide, please. Although Africa is committed to the Global Vaccine Action Plan, immunization coverage in this region is known to be very low, below the goals, hence increasing risk to vaccine preventable diseases. Yes, African countries are committed to the Global Vaccine Action Plan. However, we know that our commitment has not translated significantly to an outcome that is desired. Immunization coverage varies across African region due to several factors. And the large numbers of the countries in African region depend largely on donors to finance vaccination programs, with government of Africa contributing to vaccination, to vaccine program with less than 50% funding. Some of the countries in Africa already engage community pharmacies in vaccination, vaccine provision. We are aware of the South Africa, and recently we also heard about the development in Tunisia. Yes, we have also heard that some of our members from in Zimbabwe, community pharmacies in Zimbabwe have been trained.
problem of connection.
Hello. Can I be heard? Hello.
Yes, okay.
Okay. Yes, I said in Zimbabwe, we are aware that some of our community pharmacists have been trained in anticipation of official approval from the government. Next slide, please. The current strength and priorities in Africa. Vaccination priority in Africa region is the routine immunization for children, which is particularly for children between the age of 12 months and 36 months. Little or no focus is being considered for the adult vaccination. And we also we know that emergency vaccinations, such as we have the COVID, will negatively impact the routine vaccination program that is well established. However, the good news is that, again, only in September 2020 this year, 2021 this year, Nigerian government through the Ministry of Health launched the new vaccine policy, which is focusing on local production of vaccine and to ensure self-sufficiency in vaccine availability in Nigeria. We hope that this policy will translate to having vaccine. We're aware that NAFDAC in Nigeria are getting ready to prepare the country to be able to become a hub for vaccine manufacturing in Africa. And we hope that this will come into reality in a short time possible. What are the regional weaknesses we can find with our region? Of course, just as it's with many regions of the world, we have inadequate human resources and underutilization of available resources for health as a major challenge for delivery of healthcare in Africa. We do not have enough healthcare providers, just as we know in Nigeria, practicing pharmacies are less than 20,000 today. In fact, those of us in the community that service the public, the majority of the public directly, are less than 10,000 as we speak. So we also have the issue of logistics, which necessarily will impact negatively on vaccine in our country. Of course, this we know that is better. The issue of power supply in some of the countries in Africa are better, but I must say that in a country like Nigeria, this is not the issue. We have a great challenge with power supply, and this has made the issue of quotient to be a difficult issue with us in Africa. We equally have financial issue, finances. We have inadequate budgetary allocation to health. And in most cases, even when there's a budget, our budget performances in many of our countries at the different level, from federal to state and local government, has not been a very good one. We have not had a good budget performance. And this is not connected with the global economy, the unstable global economy we have been faced with currently. We also have a problem with governance. We have poor leadership and management, which has made accountability creating accountability and capacity gaps in our country and in the region. We have service delivery. We have poor integration of immunization with broader primary health facility, poor condition and inadequate numbers of health facilities. Despite the fact that we have very few functional healthcare facility, particularly in the public, it's been difficult in many countries of Africa to have the private sector, like the pharmacy, integrated as part of general healthcare delivery. Next slide, we'll be talking about one policy that we want to recommend, that we believe will improve vaccination acuity, access, and to mileage on his on the partnership with WHO to see the possibility of curating a regional policy document on legal and regulatory framework for community pharmacy involvement in primary healthcare services in this region. When I was doing research on this project, I find out that as we speak, the WHO office in the European region had gotten a document which specifically talks about the regional, the involvement of community pharmacies in primary care. It has given role to primary care, to community pharmacies in primary care in the European region, and this has greatly impacted on the uptake of pharmacies in such regions. So we want to call on FIP to prevail on WHO, particularly the African region, the African regional office of WHO, to come up with this same policy, such that this can support the population in Africa to benefit from the universal and appropriate access to community pharmacy, and the full benefit to also take benefit of the full potential of community pharmacy, and also to ensure quality of services that are being provided in community pharmacy. This should be very, very impactful. What are the policy outcomes if this policy is, is given a consideration? Of course, there will be an increase to vaccination, which is going to be one of the major primary care services that will be provided in community pharmacy, in line with the existing task shifting and task sharing policy. As we speak, WHO is promoting the task shifting and task sharing policy across the world, and Nigeria, for example, is developing a national policy in this direction. I think that if WHO can come up with this policy document, it's going to go a long way in making, under the task shifting and task sharing policy, in getting community pharmacy to be integrated as primary care service provider in Nigeria. So community pharmacies are the most accessible healthcare centers, and will increase location for primary healthcare facility by as much as 50% in some of our African countries. In fact, in Nigeria, I'm very sure. What are the contributions of my association, ACPN, through our foundation, the Transgenerational Pharmacy Foundation, to improve equitable access to vaccination in Nigeria? You will recall that FIP has a vision for primary care services as one major way to achieve universal health coverage. And in 2018, we are all aware of the Accelerati Declaration, a new pathway for primary health care in the world. And by 2019, October, in Ankara, this declaration was signed by European region pharmacists under the leadership of FIP. You can see in the slide that my humble self was part of that declaration, which was signed on the 25th of October, 2019. And taking inspiration from this outing in Ankara, when I came back to Nigeria, I had to make my association to develop our national conference for 2020 in this regard, with a sub-team of optimizing primary care delivery in Nigeria, community pharmacies, the untapped potentials. And this crystallized to the signing of Abuja Declaration, which on the road become the third commitment to community pharmacy, commitment to actions on primary care. And I must say that at this point, I want to appreciate the president of FIP, Jordan Dominic, for his support. He granted us while we're doing this in 2020. Dominic was the keynote speaker in 2020 ACPN National Conference in Abuja, and he gave his voice to the signing of this declaration. So Nigerian community farmers have signed this declaration in 2020. And we moved forward. We didn't stop there. We went forward for purpose of implementation. As soon as this declaration was signed, we moved forward to form a multi-sectorial committee. And this committee comprised of practitioners from various sectors of pharmacy and healthcare practice, both in Nigeria and from the diaspora. We have a number of our friends and colleagues from the Americas who, particularly NAPSAC, colleagues from NAPSAC were part of this, and we have some from the UK and many pharmacies from the different aspects of landscape of pharmacy in Nigeria. And the main objective of this committee was to develop a roadmap for the implementation of Abuja Declaration, and consequently to see how community pharmacy in Nigeria can be integrated into the primary healthcare delivery in Nigeria. Next slide, please. And we set up we came up with a vision to train and certify 2,000 pharmacists, Nigerian pharmacists, within the next 2 years, and to facilitate support and collaboration with National Primary Healthcare Delivery Agency, NPCDA, on implementation of pharmacy-based vaccination in Nigeria. And we also look at to syndicate support from partners, multinational regional bodies, institutional towards accelerating equity, access, and sustainability of vaccination in African sub-region. We developed one of the major quick wins from this committee, the project committee, was development of pharmacy-based vaccination training program in partnership with Messrs University. I must, at this junction, also appreciate the effort of a colleague from NAFSA under the leadership of Teresa Paz, the current president of NAFSA. They facilitated our collaboration with NAFSA, with Messrs University, to deliver, to come up with these training modules where community pharmacists were trained in Nigeria. This is one of the meetings, stakeholder meetings that was held by, you can see many of the community pharmacists from the academia, from the hospital, from different areas of practice pharmacy were involved. We consulted widely, and this was the flyer we used for the program. And we went further to come up with this training, and I'm very glad to inform all our audience that on 30th of August 2021, in the city of Abeokuta, during the first day of the national conference of ACPN, these gentlemen came from America. You can see 6 of them came from America to train community pharmacists in Nigeria on vaccination. And you can see that is the national chairman of ACPN. They have been trained on how to give vaccination by one of our instructors from America. And the strategic achievement from this first leg of our project is that we have about 161 Nigerian pharmacists who were trained and certified for vaccination and cardiopulmonary resuscitation and basic life support skills and competency via 8 modules online and dedicated physical training in partnership with the Messrs University at our national conference on the 30th of August 2021. I want to say thank you for everyone, but more importantly, I want FIP in partnership with all regional bodies to see how we can make WHO African office to come up with this policy of developing legal framework for community pharmacists involvement in primary health care. This is going to be a hero into giving community pharmacy in the sub-region to provide vaccination. And that's going to be a huge way to give access, to create access and also to make opportunity for sustainability of vaccination in our region. Thank you very much for listening to me.
Thank you, Samuel. I know your passion. Maybe we'll have given 1 hour to you to speak more about what you're doing. But your call for the involvement of pharmacies in primary health care, I think it is what I can catch in your speech. Thank you very much for that, insisting on that involvement of pharmacies in vaccination in primary health care. Thank you, Samuel. Now,
thank you,
I will give the floor to Jacqueline for the next, to introduce the next speakers.
Thank you, Prosper, and thank you to the 2 first speakers for their very interesting feedback on vaccination. That's really very, very promising experiences. We'll now go on with another panelist, and I am happy to introduce you, Redouane. Redouane is devoted to associative pharmacy world from his very, very beginning, because he was involved when he was a student already. He was the founder and the president of the Algerian Pharmaceutical Student Association, and he was also the chairperson of the African regional office at the IPSF, the International Pharmaceutical Federation. He was a co-founder and a Secretary General of the Algerian Pharmaceutical Federation. And he also is a contributor in the creation of a chapter from the International Society of Pharmacoeconomics and Outcome Research. He pursued his postgraduate specialization in different countries, including Paris in France, York in UK, and also in Spain, in Barcelona. You read one. You have a master in health economist from Barcelona. So it's my pleasure to introduce you, Edouard, and we listen to you.
Thank you very much. Merci, Madame la Présidente. I would like to thank FIP for giving us the opportunity as Algerian Pharmaceutical Federation and contribute on these different series and sessions related to the sustainable and equitable access to vaccines. So it's a great pleasure to talk about the Africa region regarding immunization and COVID-19 vaccination. And we saw in the first two presentations the challenges that we are facing in the African region related to access to vaccination. So I will be in the next 10 minutes take you through our thoughts and our contribution as well as Algerian Pharmaceutical Federation in Algeria to advocate for pharmacists in order to contribute as a healthcare practitioner in order to increase the vaccination rate in our country. So in my first slide, I will talk a little bit, I think it was covered, but just to emphasize, it's very important that over 3% of people in low-income countries have been vaccinated against COVID-19 to date, which stands in stark contrast to 60% of people in high-income countries. So worldwide, more than 50 countries have missed the World Health Organization target for 10% of their population to be fully vaccinated against COVID-19 by the end of September. And most are in Africa, unfortunately. So where the WHO's overall figure for those fully vaccinated is currently around 4.4%. The lack of accessibility and affordable vaccines for all will fully additionally waves of infections, human sufferings, and death across the globe. I think we all agree at this stage that COVID-19 vaccine injustice will also have a lasting and profound impact on welfare, jobs, public debts, and possibility for human development settings back to the 2030 agenda for sustainable development, the Sustainable Development Goals, and the pledge to leave no one behind it. So next slide, please. So you can see here in the graphs like the 2021 political declaration on the equitable global access to COVID-19 vaccines endorsed by over 180 member states notes that recovery relies on accelerating vaccination efforts and investing in the system and capacity needed to rapidly scale vaccination because its life-saving COVID-19 vaccines are not made accessible and affordable for all right now. Low-income countries would need to increase healthcare spending by 30 to 60% to vaccinate 70% of their population. In contrast, high-income countries would have to increase their spending by just 0.8% to achieve the same level of protection. So in Algeria, a low-income country, the cost of vaccination represents 4% of the total spending, which is around the 660 million of the total projected increase in public spending. So this amount could maybe destinated to other programs related to the protection, like social protection programs, crucial in the recovery from COVID-19. Next. So when it comes to my country, Algeria, and giving an overview about where do we stand for the vaccination. So it started, Algeria launched the vaccination in January 2021. and that was with the Sputnik vaccines at those times. And since then, around 12 million doses were given. Today, we are having like 4.7 million of individuals who are fully vaccinated, which represent around 11% of the population, and 12 million with the first dose, which is around 30% of population. So we are obviously have a long road ahead to reach a level of protection that would reflect equity in access and financial burden. However, it's interesting to mention that Algeria received around 300,000 doses from COVAX, which correspond of the first batch of around 2 million doses that Algeria will initially receive throughout 2021. I personally find this a huge step towards equitable distribution of vaccines worldwide. So a great milestone have been achieved in Algeria when it comes to the pharmacists contributing against this pandemic, and a milestone towards increasing vaccination coverage. So it all started in July. Different discussions happened by the government and mainly the Ministry of Health, and the different pharmaceutical organizations, how to involve pharmacists in the vaccination. And in August, pharmacists were authorized to administer the COVID-19 vaccines in community pharmacies as the government effort to increase vaccination coverage by partnering with the pharmacists. And I think Algeria is becoming now one of the pioneer countries in Africa, Middle East and Africa as well, to have pharmacists vaccinating and contributing against this COVID, this pandemic around the world, which is absolutely something very interesting and important for the pharmacist, but also for the community, as we know all as pharmacists as very close to the citizens. Next, please. So we have almost more than 1,000 pharmacists involved in the vaccination in different cities, covering all the country. So the Ministry of Health made a lot of efforts, and I would like to take the opportunity and thank all the different stakeholders and partners who participated on that. And on top of that, the Department of Pharmacy of the Ministry of Health, who advocated with the Algerian Pharmaceutical Federation and the rest of the organizations in order to make it successful. And we started with different programs, education, trainings in order to prepare pharmacists, because as you know, it's something very new, and all the propaganda around the vaccination against COVID, where pharmacists and all the healthcare professionals are hesitating a little bit, but big efforts was done by the Minister of Health on that, and I would like to take the opportunity also to thank them. Next, please. Yeah, agreed to have the vaccination, but we noticed it quickly that we are facing a lot of challenges related to the first is the enrollment of the pharmacists. The number of pharmacists, we have 12,000 community pharmacists in Algeria, and as I mentioned in my previous slide, we have more than 1,000 who are involved. So when we compare to the total number of pharmacists in the country, so we are far away from having adherence from the pharmacist, and this is related to many reasons, like the hesitation and also the scales where we as a pharmacist in the community pharmacy were familiar a little bit by providing drugs, but in our country we didn't take let's say the next level where the community pharmacy, where the pharmacists are providing healthcare services. It's challenging, but I think it's promising for the future to extend the role of pharmacists for new practices. So there is challenges related to regulatory framework, where we need to support community pharmacists' role in terms of developing the new practices, and also to focus more on the vaccination and support the pharmacist in terms of trainings, skills, leadership, to be part of this fully committed on this problem. And this can probably be addressed through providing support and capacity building activities that ensure the preparedness of pharmacists to take over the new responsibility towards society to ensure equitable access to COVID-19 vaccines. Next, please. So one also really great milestone achieved by in Algeria, which is the local manufacturing of a vaccine, where the government were focusing. You know, we were in an era where in having the doses of vaccine, it was really challenging around the world. So the Algerian government decided to work with some countries and with the local manufacturer, the government public pharmaceutical company, which is Saidal, and they are having two programs. So one already done, and it was finalized in September, end of September, where Saidal is producing one of the vaccine locally produced. And I think with this great milestone, not only Algeria will be contributing to having the doses to the Algerian citizens, but also the direction from the government is to support the African countries and provide to them vaccination in order to increase the vaccination rate in the African region. So of course, as I was mentioning, I think the challenges that we are facing in our region is first, of course, the access to the disponibility of the vaccine. But I think one of the most important challenge that we are facing in Algeria, and I think it will be it's the case for the rest of the countries today, I can say in Algeria, so we had the right doses for the community, but there is the hesitation of the citizens to get access to the vaccination. And so I think it's one of the biggest barriers currently to achieve persistent progress in COVID-19 vaccination program within the vaccine hesitancy. So this dilemma is due mainly, as I think we all know, mainly to the misinformation that raised concerns that raised, the concerns about the development and the efficacy, the safety, the efficacy of the vaccines, as well as the overall mistrust in the efficiency and the level of protection provided. So I believe that what needs to be done by policymakers and decision makers at this stage should go beyond efforts to increase awareness, knowledge, and dissemination of accurate vaccination information, but rather to reinforce legislation that somehow make vaccination mandatory to enter certain public spaces, such as policy, and actually make the difference in achieving vaccination rates that would ensure the protection of the population and boost the region. So finally, to sum up, the pandemic has taught us harsh lessons about the impact of health and social inequalities, and we should not forget how fragile our societies can be. The equitable distribution of COVID-19 vaccines is not only a public health challenge, but also a solidarity test for the governments. Guaranteeing equal access to COVID-19 vaccine regardless of social, administrative, or legal status is of utmost importance of ensuring effective prevention within countries, but it requires a strong political commitment to invest in vulnerable groups and their access to healthcare and prevention services. Similarly, equitable distribution of vaccine between rich and low-income countries need policy efforts, including cooperation to reduce inequalities and advance health equity. All this should go hand in hand with collaborative efforts to achieve the immunization coverage rate requested by WHO to overcome this pandemic. Thank you, everyone, and give the floor to Madame la Présidente.
Thank you very much, Redouane, for this very, very interesting feedback on your experience in Algeria. It's very, very encouraging when we listen to you. Thank you for your commitment. We are now moving to another part of Africa with Mariette. So Mariette Eckstein You are the Professional Development Officer at the Pharmaceutical Society of South Africa. You are also an elected member to the South African Pharmacy Council and an executive committee member of the academic section of FIP. This is where we know you. And you're also the global lead for Advancing Integrated Services, which is the development goal number 7 of FIP in the Workforce Development Hub. Recently, Mariette was appointed the project manager officer for the Independent Pharmacy Emergency Fund, established by the Independent Community Pharmacy Association to generate financial support for independent pharmacies affected by the recent lootings and unrests in South Africa during July 2021. This is a real program, Mariette. Mariette has a PhD in health profession education from the University of the Free State from 2017. And in a nutshell, she has a passion. It is pharmacy. And she enjoys national involvement of the profession as well as international. She has been a member of FIP since 2008. And with this, Mariette, we listen to you.
Good afternoon, Jacqueline. Good afternoon to my fellow panelists and also to everybody joining us for this event. Thank you so much for the opportunity to also share a Southern and South African perspective on this very important topic of vaccination and how we address things such as equity, access, and sustainability. So my approach is slightly different today to that of my previous colleagues and previous speakers. So I would just like maybe to put everything in perspective, give you an update on South Africa and where we are with our COVID-19 vaccination. So today, to date, we have more than 2.9 million individuals that was tested positive for COVID-19 out of our almost 60 million population. Unfortunately, we just almost have 90,000 deaths. To date, we issued 22.8 million injections, COVID-19 vaccination injections. Our capacity at the moment is we issue around 158,000 COVID-19 vaccinations per day, but we actually have a workforce capacity of close to 350,000 vaccinations per day. So currently we are below our target, and that is due to the public not showing up or not using this opportunity to be vaccinated. So in terms of percentage, we are very proud to report that almost 39% of the South African population has been vaccinated. And as I've been listening to my previous speakers and colleagues from the African continent, definitely we are privileged on our progress when I look at our colleagues that are still struggling behind us. But we cannot emphasize enough how important it is to get everybody vaccinated so that everybody can be safe. So if I can take us through maybe strengths and priorities with regards to vaccination from the South African continent or South African perspective. I think firstly it's important to know that pharmacists in South Africa do have vaccination rights, and this comes from our Pharmacy Act and our scope of practice. So pharmacists also have access to several childhood and adult vaccines due to the schedule of these vaccines without a prescription from an authorized prescriber. So this really opens up the opportunity for vaccination. We also have minimum standards that was published by our regulator long before a pandemic that guides vaccination services in pharmacies. So this was already there before we entered the pandemic. However, the pandemic did assist to fast track a few things, whether it's just policy or whether it was mindsets. So the first thing, and I've noted that some of my colleagues have mentioned that they do not have it. So I think once again, South Africa should be privileged or thankful for what we have, is that immediately a national training program was developed for every healthcare worker that wanted to provide the COVID-19 vaccine. So this is important to ensure that everybody's on the same page in terms of content and that the user have a similar experience no matter where they go for their COVID-19 vaccine. There was also a national register of vaccination centers. So you can go onto a website and you can see immediately where you can access your nearest vaccination center. There was also regulations for COVID-19 vaccination centers, and this was through a permit process for both the National Department of Health in collaboration with the South African Pharmacy Council to ensure that a vaccination center are within the permit conditions and that there's someone taking responsibility for everything that happens at that vaccination center. Both private and public sector facilities were allowed to vaccinate insured as well as uninsured lives alike. My apologies for that spelling error. So just to put this into perspective, South Africa still have a two-sector healthcare system. We've got the public healthcare sector that's funded by the National Department of Health, by the public sector. That serves roughly about 80% of our population, but only with about 20% of the total spent in healthcare. Then on the other hand, we have the private healthcare sector that looks after insured lives. That's only roughly about 20% of our population. So this includes insured lives as well as people willing to pay out of pocket for healthcare. But 80% of our total healthcare spent per year happens in this sector. We also have VUMA weekends to boost our vaccinations, especially in the public sector, because the public sector unfortunately only operates during weekdays. It's mostly the private sector that works, that operates on weekdays as well as on weekends and public holidays. But this impacts on the availability of sites and access to citizens that also works during weekdays and maybe can only access a vaccination site over weekends. And then currently, the South African Pharmacy Council is looking in developing supplementary training for pharmacists on immunization and injection techniques, which will also lead to a broader supplementary training and scope for pharmacists, because one of the problems is that the COVID-19 vaccine is currently on a schedule that is not accessible to pharmacists without a prescription from an authorized prescriber. So for this reason, to make it more accessible for pharmacists, there must be a permit to give you access to this vaccine. If we move to the next slide, unfortunately, not everything is nice and wonderful in South Africa. We also have a few weaknesses and challenges that impacts on our program. So again, as I've mentioned, South African pharmacists always had vaccination rights. And I know even before the pandemic, FIP did a lot of work in this regard to help other countries to also get vaccination rights. However, there was a lack of uptake of this service by pharmacists in South Africa. So although the opportunity was there, it wasn't as taken up as seriously, whereas with the COVID-19 vaccine, it really opens up mindsets and it really opens up the opportunity that pharmacists and pharmacies have to offer this service of vaccination in general. When we go back to the COVID-19 vaccine, and my colleague Samuel has reported on this as well, is the limited stock that we initially received, as well as hiccups with the supply of vaccine. So in South Africa, we were due to start in February with vaccination of AstraZeneca, and then the beta variant was detected in South Africa, and we couldn't access the AstraZeneca vaccine. So we had to let it go, and we had to make another plan to get ourselves up and running. We had a lot of hiccups with supply chain, but just because it was a global demand for a product, and we were just another number in the queue. And unfortunately, South Africa, being a middle income country, just does not have money to throw at positions, or to throw ourselves higher up in the queue for demand. Initially, there was difficulty in terms of collaboration between the public and the private sector. For instance, that very brilliant training program I referred to was initially only developed for public sector. And it really took a lot for us to say, but what about the private sector? You have no idea how much we can support you, but this is really limiting by not opening it up to the private sector. Also, the uninsured lives initially was only limited to the public sector. And as I've mentioned in my previous slide, that's only limited to weekdays, which really makes it difficult for colleagues to, or the public then, to access this on weekends when they do not have to be at work. We have difficulty in adhering to protocols initially. We are still working on a best practice protocol because unfortunately, not everybody maybe align themselves to the best interests of the bigger picture. And then also I saw there's a question as well we would like to answer in the Q&A session on hesitancy, the impact of fake news and illiteracy when it comes to patients. So lastly, I was asked about what is the one policy change that we can use to increase vaccination and to help achieve equity. And I really gave it thought, and I asked a few colleagues. And the one thing that I think in practice will make a difference, because remember, a lot of things on paper is great, but at the end you needed to get it into practice, is that we really need to integrate vaccination in routine services and everyday life. So in the South African context is that we need to have vaccination sites at taxi ranks or bus stations where the public move, where they pass on their way to work or to home. Then also something like in South Africa, we have quite a large grant system. So when the pensioners or the SASSA grant receivers go and access their monthly grant, that is the ideal place to have a vaccination center. We also on Monday had our local municipal elections, and I know there was a few stations that had vaccination sites there because obviously the public is queuing to cast their vote, and it's an ideal opportunity to also have them there and to access that opportunity. Then also outreach programs, mobile clinics, and then weekend outreach programs at, for instance, shopping centers, ideally at the end of the month. So colleagues, this is what I have to share from my side, and I'm looking forward to the opportunity to answer a few questions. Thank you, Jacqueline.
Thank you very much, Mariette, for your enthusiastic presentation. Thank you. So, dear colleagues, we have had a panel, which is a very interesting presentation. So, I would propose we enter to the Q&A sessions. Could all the presenters come on the stage with your camera, open your camera, and let us begin. So, Prosper, we have a lot of questions, don't we?
Yes, so we have.
Yes, we have a lot of questions. I've looked at them, all of them. Yeah, so there is a question. I think we could begin by a question because this is raised several times. A question about the reluctancy, the hesitation from the healthcare professionals and also from the patients, well, the individuals, the citizens, let us say, because they are not really patients, you know. Could we address that as a first question?
Yes, I think it's an important question. And
yeah, I think it's a key for many persons.
Countries, the is there. Wow.
Who Who is going to answer this question? One of the panelists. Yes.
Jacqueline, I would like to start because really we've witnessed the same in South Africa, and I think what is the best approach is that one needs to understand that people take decisions differently. Okay, so I think when it comes to a healthcare professional, it's slightly easier because you can maybe reach out and ask them like, what part of this process is difficult for you to, that scares you or creates fear. Because remember, all of this was actually part of our pharmacy degree. We've learned about the manufacturing of medicine. We've learned about vaccination. We've learned about public health. So this is really not new. But sometimes our colleagues maybe just struggle to fit this into the body of knowledge. When it is a member of the public, what you can do is also ask them, what is causing fear? Would you like to talk about it? Do you have any unanswered questions? Because sometimes it's really a very small thing that's preventing them. And I think we sometimes forget how privileged we are with our information that's common sense to us, but to a member of the public, it could be intimidating. And they don't know where to slot this in to the bigger picture and the bigger scheme of things. And I think for this reason is if you just can open the conversation and you can direct them to where there's factual information. In South Africa, it's our National Institute of Communicable Diseases. You can find everything there. So if you can just direct them to the right place to address their fears, you're really halfway there.
I'm sure of that, Mariette. I'm sure of that. You know, in my country, I am a vaccinating pharmacist. I am a prescriber. I don't vaccinate the nurses who vaccine. But as a prescriber, I have had some experience, which is quite amazing, from patients, young patients, saying they were afraid to get sterile if they are vaccinated. So this is a kind of false information that we should really be against, and I'm sure you agree with that. Who would like to answer, to have some more input from the panelists? Yes, Samuel.
Yeah, thank you. Well, I want to say that here in Nigeria, we don't have too much problem of hesitancy with the professionals, with pharmacists or even medical doctors, but just a pocket of individuals that have that issue. And again, for the general public, one critical problem we have is the issue of religion. You know, Nigerians are very religious, and particularly the Christian religion, the Christian faith. There are a lot of information going around that, oh, this is a chip, the vaccine is going to introduce chips into your body to give you the signs of Antichrist, and all of this and all of this. And I think quite a number of us had an opportunity to engage with even religious bodies. We've had the opportunity to engage. I know one of our professors here on this website, on this chat room with us, and that's an opportunity to also, engage with the whole state ministry of health and healthcare providers, and many of simple things that we're using to deceive people were being debunked. For example, you see somebody taking vaccine and it puts a light bulb, put bulb, energy bulb on the palm, on the shoulder to say that it got, the light got lighting because of the vaccination. Of course, this was being debunked by the mere fact that using water, just putting water on any part of the body and put this bulb will give light. So these are one of the ways in which we have debunked such rumors, such false information, and so much. I think advocacy, continuous advocacy, we will surmount this. I know that if vaccines are available and the community, because that's critical, and the community, Nigeria, for example, we are set, we take vaccine. That I know. Apart from the issue of religious belief, and which is a major issue, but I know we can for sure overcome such situation or scenario here in Nigeria. This is also applicable to many of the African countries. Thank you very much.
Thank you, Samuel. Well, Prosper, we have other questions. Which one would you like to choose?
I think there is a question of about the difference. You know, the problem of training pharmacists.
Okay, that's a good question. Yeah, it's a key question. You're right. Okay.
Yeah, sorry. If I might quickly talk about the training of pharmacists, like I said, the committee we put in place in Nigeria, the multi-sectorial committee that we put in place, came up with a memo which we sent to the Pharmacists Council of Nigeria, which today has received the acceptance of the council and even the National University Commission. And I will be believing that the curriculum of pharmacy students are being reviewed. I mean, pharmacy training of pharmacy students in Nigeria are being reviewed currently, and we are very optimistic that primary health care services, particularly like vaccination, will be incorporated to the training of pharmacy students in Nigeria going forward. And again, for us as community pharmacists, we have developed a program with Messrs University, which currently we are using to train community pharmacists. We had the first outing where 160 pharmacists, 161 pharmacists were trained, and we're looking in another few months for another round. So this we're going to continue to get all pharmacists that are interested, both in the public, in the hospital, and the community trained. And I just feel that these can be transmitted to all other Africa. Other countries. In Africa that are yet to have a standardized modules for training. For us, we have gotten one which is available. It can be shared with any of our regional countries that are interested. And I also know local programs could be developed. It's not a difficult thing to do. So let us, once there's a commitment, once there's a will to move forward in getting as many community pharmacists and pharmacists, even the hospital trained for vaccination, I know we will surely achieve it. It's a goal that is achievable. Thank you.
Thank you, Samuel.
Thank you, Samuel. I think that we have 5 minutes to the end of just 5 minutes.
Yeah, I think we have time for another question. Yeah.
Yes, just another question. The question that is coming is the question of somebody wanted to address a question to Redouane about the remuneration.
Yes.
About the remuneration of pharmacists working, vaccinating. What is the situation in your country and in South Africa?
Yeah, I think it's really a great question where we are talking about the remuneration of pharmacists, but we believe, and the Algerian Pharmaceutical Federation first, we need to work on developing practices in the community pharmacy first and show how pharmacists can play a key role in terms of providing pharmaceutical care. And at this time, when there is new services provided to the community with added value to the healthcare system, I think at this time we can move to the next step and request remuneration. Because we discuss a lot about this topic internally, and we cannot, at this stage, just prescribing and not prescribing, but providing the drugs. And we have today the experience with the vaccine, where the government decided to authorize the community pharmacies to do it. But when it comes to implementation, so we see the hesitation. We see that there is, we need to be qualified in terms of skills, and even the vaccination, the vaccination, let's say, practice is not something very strong. Where when it comes to the rest of the practices, where we need to be to have the skills, when we need to have the time, the dedicated place in order to give the counseling, the advices to the patients. So I think we have a lot to do first in terms of standardization of our role and practices. And then when we demonstrate the added value that we can bring to the patient and to the healthcare system, at this stage, we can move to the next step and open the discussion with the social security for the remuneration. And by law, because the question of our colleagues from Algeria, yes, the law now, there is a new law in 2018, have been done by the Minister of Health, which opens the door to pharmacists to get remunerated. But I think there is now the laws that they need to be addressed in the future related to the services, the remuneration. All these things also need to be prepared in order to, to have a benefit for the healthcare system. But also on the other side, there is a budget that should be dedicated for that from the Social Security, and they are very sensitive to that. So they are very sensitive to put an additional budget for remuneration. So we need to be really pragmatic. First, again, to provide services and think what will be the best way to have a model for that, and they discuss it with the Social Security.
Okay, thank you. Just a few words, Mariette and Daniela, to conclude about it, because we have to end our interesting session.
Thank you, Prosper. Well, in South Africa, if I can add, obviously in the public health sector, there's no service fee because whoever is participating in vaccination of the public, that's part of their daily job, and they are remunerated a salary at the end of the month. But in the private sector, it's slightly different because the pharmacist or the pharmacy owner have a cost involved in providing the service. Not only the cost of the vaccine, because that's paid by the government at this stage, but the cost for the service. So in South Africa, we do receive a fee. I can't remember the exact fee, but it's around 70 or 84 rand per person, per vaccine, or to do the injection, the vaccination. So if you ask any pharmacist in South Africa, I guess we'll never be happy with the money. And if you ask the government, they will always feel they're paying us way too much. So it's a balancing act. But to add to my colleague from Algeria is, at the end of the day, we need evidence, we need stats, we need true costs, and we need financial people to help us with that, because we're not going to figure this out as pharmacists on our own. Thank you, Prosper.
Thank you, Mariette. Daniela, you have the last word.
Yes, thank you. Thank you, my fellow speakers, for all the insightful presentations. Now, in Kenya, we're still in the training phase for our pharmacists to administer injectable products as well as administer injections. So we know that that's a policy objective that we've packed, but we are ready for it in terms of getting pharmacists to be remunerated for their service, but we're not there yet. We hope to get there. Thank you very much, Prosper.
Thank you, Daniela.
You know, Prosper, with such commitment and such dynamism from all the presenters, I don't know why we could not go forward. So I'm very optimistic. Thank you, all of you, and back to you, Prosper, for closing an announcement. There is a new summit, yeah?
Yes. The FIP Leadership Summit on Pharmacy-Based Vaccination Policy and Advocacy is the final episode of FIP Transforming Vaccination Globally, Regionally, and Nationally 2021 program. The last of 12 episodes. The summit is a high-level event in which we will first recap the primary outcomes of the program, launch and adopt the FIP commitment to actions on sustainable and equitable access to vaccines through pharmacy. Third, discuss regional priorities and needs with pharmacy leaders from the world's 6 regions. Fourth, hear from global leaders from health and pharmacy on how we can reduce inequities and widen access to vaccination. 5, carve the pathway to implementing the commitment and integrating pharmacy-based vaccination within life course immunization. The digital event will take place on the 18th of November at 2 p.m. Please register by scanning the QR code on the next slide or visiting the website event.fip.org or transformingvaccination.fip.org. We are at the end of our session. I would like to thank all the speakers for the interesting presentation, to thank the participants, the attendees. Thank you for attending. We have learned a lot and we'll go forward. There are many things to do together. Long live FIP, long live APF, long live Africa, long live all of you.
Thank you. Bye-bye.
Bye-bye.